I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it.
The IDD Health Matters podcast is a joint production between Friends for Life and Intellect Ability. For more information, go down into the show notes and click the link where it says Learn More Here.
Hello, and welcome to this episode of IDD Health Matters. I have a wonderful guest today, Allison Barkoff, who's done a lot of great things with the Administration for Community Living. Now you're at George Washington University. Yes. All right, Allison, I'm so excited to have you here. The first thing I want to ask you is, how did you get into the field of working with people with intellectual and developmental disabilities?
Well, like so many people, this comes from my own lived experience. I'm a sibling, and my brother, Evan, was born with an intellectual disability in the late 1970s. At that time, our family was told, like all families were at the time, that the only place for Evan was in an institution. And my parents were told to place him and come raise me and my sisters. And we were part of that generation. It was actually, I think, in large part because of some civil rights laws. And 2 years before Evan was born, public schools became open to kids with disabilities. And my family was part of that first generation that was looking and fighting for something different. And so literally for my entire life, both personally and professionally, first alongside my brother and my family, and then nationally, I have been fighting for the rights of people with disabilities, for community services, for civil rights laws, for inclusion. So I have seen a lot of changes over these last 40 or so years.
I bet you have. And a lot of good changes, and not only seen them, but you actually spearheaded a lot of those. I know that. Yeah, I know you may not want to say that, but I know you have. I know there's probably been a recent one that you've been really excited about, right? Tell me, let's talk about that one.
So one thing just for me, there's both the work on the policy side of creating community services, and I've done a lot on that. We can talk about some of the recent policies. I just recently left. For the last almost 4 years, I was leading an agency in the U.S. Department of Health and Human Services called the Administration for Community Living. And that brings together the aging and disability programs that are focused on helping people live and participate in the community. I am a longtime civil rights lawyer and disability rights lawyer, and one of the many things that I was really excited to be part of at ACL was updating for the first time in almost 50 years the civil rights regulations called Section 504 of the Rehabilitation Act that prohibit disability discrimination in all entities that get funding from HHS. So that means doctors' offices, that means states, that's all health and human services.
Now, and correct me if I have this a little off, but some of these things were prohibited like 35 years ago or more, but people still don't necessarily follow those rights. Am I correct there?
Well, in some ways, yes and no. So the statute has been around since the 1970s, and regulations, which kind of lay out in more detail what is allowed and not allowed, came out in the late 1970s. And think about how much healthcare has changed since then. For example, websites, kiosks, like actually the fact that people with disabilities have a civil right, according to the U.S. Supreme Court in a pinnacle decision called Olmstead, to live in the community. None of those things were in the regulations. So, in some ways, yes, we've always made the case as lawyers that lots of things were allowed or not allowed, but to have just this comprehensive update. And I think the thing that is most amazing to me about these rules is we did them after COVID.
I was gonna bring that up if you didn't, because that was one of the things as a healthcare provider and who works in this field that was clear is we know that people with intellectual and developmental disabilities and disabilities in general really had some significant health disparities let's just say, deprioritization maybe from certain levels of healthcare like ventilators or ICU beds.
Yeah.
And those are some of the contributing factors that led to higher incidences of death in people with IDD.
Yeah. So let me tell you what I saw. I'll be even more direct. We have seen really insidious discrimination. The word that we often use is ableism. And what is at the core of ableism is the idea that the life of someone with a disability is worth less than someone without a disability, that disabled people are burdens, that, stereotypes about what disabled people can and can't do. And we saw that, as you mentioned, in COVID, literally when hospitals were putting in crisis standards of care to prioritize who gets a ventilator, there were some states that literally said, and some hospitals, if you have an intellectual disability, to the back of the line, or even they completely excluded them. And we started bringing these lawsuits and complaints. And what became clear to all of us is, wow, we need to update these regulations. But it wasn't just COVID. For those of you who maybe have experience with things like organ transplantation.
Yep, that's been an issue for a while.
It's been a huge issue for a while. And again, before these regulations, there had been some enforcement actions by the Department of Justice when hospitals would say, oh, you have an intellectual disability. We're just presuming you won't be able to take care of yourself, or it's a waste of an organ. And what is amazing in these regulations is they very clearly lay out that those kinds of things are illegal.
Now, I talk about this, and this is serious now, so I do talk about this. There are times where it might not be appropriate for a person to receive, say, a transplant or some other level of care. So we're not saying that, you have to do more, but what we're saying is that you cannot, and you should not, and you better not exclude a person from some sort of health care solely based on their diagnosis of disability or intellectual
That's
disability.
exactly, what these civil rights laws say. You can't base things on stereotypes.
Yes.
You actually have to individually look at the person's circumstance. And if it's, a medically contraindicated, of course it's not appropriate. There is still deference to the judgment of medical professionals, and the regulations actually talk about that. But when the judgment is based on a stereotype, or when you categorically say, oh, we're presuming all people with IDD can't do this, without looking at their individual capacities, the support they have around them, that's when it's a problem.
And when we don't see a certain group as people, if we don't see them as people, if we don't think of them as a person with a value, with a quality of life, even though it may be a different quality of life, it doesn't mean it's not a good, or it's, something's wrong with their quality of life, because it's not the way you might think you should value quality of life. But when we don't see people as people first, we're not going to treat them as people first.
Absolutely. And actually, some of the most shocking studies, and they are actually cited in the regulations, is the fact that when you survey doctors about the quality of life of people with disabilities, they almost universally say it's very low.
Yep.
When you survey people with disabilities themselves, they almost universally say their quality of life is pretty high. And so that's really the type of stereotypes that we are trying to really make sure don't seep into medical decision making.
And that is where, to me, one of the biggest ways to impact that is to educate healthcare providers on all of these topics, but also, clinical skills and how to provide good healthcare for people with intellectual and developmental disabilities. I use this example a lot. I'm a family doctor by training. If you came to see me for a cataract surgery, you would go blind. You would have a terrible outcome, because I'm not trained to do that.
That's right.
That's not within my wheelhouse as a family physician, though. But to provide a basic level of healthcare to anyone out there is in my wheelhouse as a primary care provider, and I should be trained to be able to do that. And that is one thing that I think we really need to continue to work towards is implementing training in all health professional programs for all clinicians to be able to meet the needs of everyone.
I completely agree. And actually, there's a federal agency called the National Council on Disability, and their job actually is to make recommendations to the president, to Congress, to federal agencies. And over the last several years, they put out this health equity framework.
Yep. I'm very
And
familiar
I
with it.
bet you are.
Great.
It is great.
Yeah.
And a huge piece of it is, and one of their major recommendations is we have to start training medical professionals, starting in medical schools, working with doctors. I mean, again, in the survey I was referring to, the question was, how many doctors would feel comfortable treating a patient with a disability? It was an incredibly small minority.
Yep. I know which survey you're pointing to as well, too. And, in the NCD recommendations, the thing that I like, there was a key word in there that they talked about implementing clinical care curricula. Not just, so I think it's very important that we all understand the world of people with disabilities, communication differences, different support levels, all of that stuff is very important. But there actually are clinical diagnostic skills that need to be taught in health professional schools to improve outcomes in people with IDD. I learned this the hard way. I wasn't taught these things, and I became responsible as a medical director for a large facility for people with intellectual and developmental disabilities. And it took me 5 minutes to realize I'm not sure what to do. I'm not sure what this picture looks like. I haven't, experienced this before. And that's why it's not just learning the world. It is, these are clinical signs and symptoms of particular diseases. That is well within a health professional school's training program. And they look different sometimes for people with intellectual and developmental disabilities.
The irony is often in the IDD world because people weren't living as long 20 or 30 years ago. There was a lot of expertise that were built in pediatrics.
Yep.
And then people aged out of pediatrics, and there were so many people for a long time who begged their pediatricians in their 20s and their 30s to stay there. And it's been very recently, actually, that there has been expertise in kind of adult health. And to your point of just some examples of things that are different, people with IDD age differently.
Yep.
I am a sibling of someone with Down syndrome. And when Evan was born and his life expectancy was only 16 years, no one could even think about things like dementia and Alzheimer's. And now we know by the time someone is in their 60s with Down syndrome, there's an 80 to 90% chance
of having dementia. And we see it much earlier in people with Down syndrome.
And sometimes people think, oh, this is behavior, this is a mental health.
Or just what they do, which brings to the topic of diagnostic overshadowing, where we attribute a person's actions or behaviors or what are actually signs and symptoms of some treatable condition to just their overall diagnosis. Oh, they have an intellectual disability. They just hit themselves in the mouth sometimes. Maybe they have 3 dental abscesses that have never been addressed, or maybe they have a sinus infection or whatever it is. And we just don't even look sometimes if we don't recognize how these can be presenting signs of common conditions.
It's so important. I will just say, as a lifetime advocate, I am so happy to hear people like you really sharing this and making sure people know about the importance of this field. I think we've done so much thinking in the medical profession around health disparities and health equity and how do we reach underserved communities. And for too long, disability just has not
even been in that conversation.
No.
Okay. Yeah, this is actually pretty fun. I get excited when I talk about stuff like this, and yeah, it's clear that you do too. So we're definitely going to keep on talking about this.
We sure are.
Gosh, Allison, okay, so I know you recently left your role as the acting administrator.
That's right.
ACL. Yeah. And what's in the future for you?
Yeah. So I want to share kind of an experience that drove me to where I am. I joined the Administration for Community Living in January of 2021, the first day of the administration, Biden-Harris administration. It was the worst of COVID.
Yeah, right in the middle of it.
Right in the middle of it. And, I had seen so clearly what happens when public health systems, when healthcare systems don't see, don't know how to serve people with disabilities. And so much of my first 2 years was really actually working with the public health and healthcare agencies across HHS and partnerships, and then working to build those partnerships at the state and local levels. It truly changed me. And when there was an opportunity, the first time this position became open in 20 years at the George Washington University Milken Institute School of Public Health, there is a endowed professor, the Hirsch Health Law and Policy Professor, who also has an opportunity to lead a health law and policy center. I thought really bringing my long background of disability rights, of disability and aging policy and long-term services and supports, and bringing that into a public health space felt like such an opportunity. In some ways, I've been preaching to the choir. I mean, people who at least are oriented around these issues. And to be able to go into this bigger space, say, great, you care about equity, you care about underserved communities. Great. I have a community you don't know about that you need to work with. So
And it
I'm
intersects
excited.
all of these other communities that you're looking at as well. So,
Of
yeah,
course.
yeah.
So I just started 3 weeks ago.
Congratulations.
Thank you. And I'm really excited to think about the impact that I can have there.
I want to jump on that point you brought up about sometimes we preach to the choir. And that's something that I've experienced as well too, is, like we're at the NASDS conference. So it's the National Association of State Directors of Developmental Disability Services. We got lots of letters in this field.
We should.
But great organization, great conference, state people who work in this field who are doing fantastic work, by the way, to improve supports and services for people with IDD. But sometimes we're talking to ourselves, and we're telling ourselves the problems that we all know about, and providing solutions that we're all working together on. We have to reach people outside of this field.
Yeah.
And that's one of the things, I do a lot of talks on healthcare for people with IDD. And I love when I get to talk to a group that is not a DD focused group. Like I've been able to present at the American Academy of Family Physicians conference for a couple of years. And it's like, DD, I'm getting this out there. I'm getting this medical training to the wide, group of family physicians, not just people who work in this field. And that is something that I think is really important that we all do, which is one of the reasons we do this podcast, actually, to get information, not just to people who know this field and work in this field, but to help people understand this field and also to see it as a valuable career opportunity as well.
It is. And I am so glad you're doing this. I am going to share this across my public health world because, again, I agree. We really, really need to make sure that the broader systems care about the people that we advocate for and that we serve and that we love.
And it's millions of people. It's not just a handful.
It is.
I really look at it.
Friends for Life Residential Care, specializing in support for individuals with developmental disabilities, offers services like adult day support and home health care. Emphasizing empowerment and quality of life, we live by the motto, "My ability is stronger than my disability." We are currently hiring, welcoming those passionate about making a difference. Learn more and explore career opportunities at friendsforliferc.com.
I'm Dr. Craig Escudé, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisks.com to learn more about how you can employ these tools with people you support.
So, Allison, one of the things that I like to do is I ask guests to give me 3 things in 3 minutes. I'm not going to hold you to 3 minutes. You can talk as long as you want, but 3 things that you feel are really important for people to know that you think can improve the world for people with IDD, or the more supports and services, or health and wellness, whatever your top 3 things are.
Whew, top 3 things. I would say the first thing that I see that over these years has made the biggest difference is get to know someone with an intellectual and developmental disability. People come in with perceptions, but it's not really until you actually know people that you see that there's such diversity in people with IDD. People have so many different strengths and capacities. And I think actually the reason we have made progress, not that we don't have a long way to go, is because people with IDD are part of our community now. They're in the classrooms with us. They're in our workplaces. They're part of our family. They're part of our churches and synagogues and mosques. And I think number one is just at a really basic human level, be open to those kinds of relationships.
Excellent, number 1.
Okay. Number 2, I would say, as a civil rights person, and especially if people watching this are in the healthcare field, I just want to lean in on the fact that this is a community that if you really care about reaching people who have some of the biggest health disparities, it is people with IDD. And as you point out, maybe people with IDD who cross other communities that are also underserved. So a person of color with IDD, a person who's LGBTQ with IDD. So if you are a person who thinks about health disparities, if you are a person who thinks about reaching the hard to reach and underserved, if you're not working with people with IDD, you are not doing what you think you're doing.
You're missing out on a very important group of people.
Number 2.
Yeah.
Oh, number 3. Number 3 is we have a really complicated, fragmented system for serving people with intellectual and developmental disabilities. And without getting into a very long history, it was created at a time where people were served in institutions separated from the community. And we've kind of done an add-on and an exception. And now we have the system where most people live in the community. Most people either, continue to be part of their families and in their school. But we have a system that was kind of created in a different world. It is really complicated to navigate. And if you are serving someone who has an intellectual and developmental disability, it's a challenge. And please still do it anyways.
Right.
It is sometimes intractable to figure out Medicare and Medicaid and private insurance and how you get things, but that is the system we have. We are all working to improve and streamline it, but just come in with eyes wide open of the complexities, and it's worth it.
I couldn't agree with that more. And I'll add a little something to it is we who work in the system know that it is complex. We know that it's challenging, but we definitely are working to simplify things. And I see evidence of that all the time. I see policies changing. I see ways of doing things changing. I see, making it easier to access certain services. Yes, there's a long way to go, but it's happening. So don't lose faith.
Yeah, great.
Allison, it's been a real pleasure.
Thank you.
I've enjoyed hearing you speak at so many conferences before, and I'm so happy that you took the time to talk with me today. And thank you for that. But thank you for the incredible work that you do in this field. And I can't wait to see what you do next.
Thank you again for having me.